I went from living a normal life that Friday morning and not being worried really that much to that night finding out I have cancer and not knowing where my life was going to go from there.
Coming up today, a teenager, a tough diagnosis, and a life-changing surgery. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. This simple movement, wiggling his toes, it tells a powerful story. For John Kermer, it's proof of what's possible after a rare cancer diagnosis and a surgery few have ever heard of. 17-year-old John Kermer lives the typical teenage life: soccer, basketball, golf, and his current passion, playing saxophone in the Shawnee Mission South High School marching band. But it was while playing soccer at the age of 13 when everything changed. John was injured during a game one night. The Kermers thought it might be a bone bruise. The news that came back was unimaginable.
It was a pretty emotional call to have to call your husband and say, it's cancer, and I think you need to come down. So for a while, it's the word, and then it's the emotion, and it's is this a dream or is this a nightmare? Is this real?
John was diagnosed with osteosarcoma, a type of bone cancer. It would require rounds of chemotherapy.
He had to come home one day when he first started chemo because his head was itching. His hair was dropping out in clumps. And he came home and asked Dad to shave his head. And that was really hard to do.
But his treatment would inevitably require more.
I wasn't sure what was going to happen with my leg. And I remember sitting there wondering, like, am I going to have my leg amputated?
The answer was yes. John would need an amputation above the knee. The news came as a shock, as did the plan offered by orthopedic surgeon with the University of Kansas Health System, Dr. Howard Rosenthal.
When we first heard rotationplasty, we were kind of caught off guard. You want to do what, with who, with how, and all of that. We came home and thought Dr. Rosenthal was a little bit off his rocker.
A rotationplasty, a complex procedure that involves rotating the lower leg 180 degrees and moving it up to create a new knee. The drastic surgery would allow maximum movement for John. John made his decision to get the surgery. And today,
so my foot is on backwards and I can kind of take it off and show.
He has a new appreciation for what his new leg allows him to do.
Well, how would you raise your hand?
I would go like this so I can.
He got back to friends and to school too.
And I remember I came back and was all nervous, and all I got was like warm welcomes and like people coming up to me, talking to me, asking me how I'm doing, helping me out, and just all I got was kindness. And I was nervous that that wasn't what I was going to receive.
And the kids were wonderful. They were wonderful.
And what was once a huge setback for John is now a major step forward.
You have to see the blessings in life, and even having cancer, even though it sounds insane, is a blessing in disguise. I'm not going to say I'm thankful for having cancer, but I think it made my life turn for the better.
And we are hoping to be joined by John and his mom Celeste sometime during our broadcast this morning. But in the meantime, we are so happy to be joined by John's orthopedic oncologist and the medical director of the Sarcoma Center with the University of Kansas Cancer Center, Dr. Howard Rosenthal. And we also have John's physical therapist from Children's Mercy Hospital, Nathan Apple. Gentlemen, so glad to have you with us.
Thank you. Good to be here.
Just sharing such a powerful and very, very interesting story. So we're going to learn so much about exactly what a rotationplasty is. And I guess I understand we have John and Celeste with us this morning. Good morning to both of you.
Can you hear us?
I can hear you.
Okay.
Good to have you both.
Yes, we are here.
Oh, I'm so glad. I'm so glad. John, how are you doing today?
I'm doing good.
So, a senior in high school, tell us just how senior year is going and just what are your plans after high school?
It's going good so far. Just trying to get all of my classes done and ready to graduate. Next year I've been accepted to K-State's architecture program. So I'll be going up there in the fall to study that for 5 years.
Nice, nice. Things are going well, and we like to hear that. You know, John, you've already been through something most people will never go through in their lifetime. How has this experience shaped the way that you look at the next chapter of your life?
It's kind of completely changed my whole outlook on life, kind of having a new appreciation for everything, wanting to go out and do more, be more active, like take more, do more things that I wouldn't have necessarily done before. Just because I know, like, I have a second chance now, like, I need to do that. Like, like this summer, I plan to go skydiving. I don't think before this I would have ever wanted to go skydiving, but now I kind of I want to go do things like that I never really wanted to do before, but like having a second chance now at understanding how valuable everything is and going to do more like fun, kind of out of the ordinary opportunities like that.
Celeste, I see you shaking your head. What's it like having to
Yeah.
just kind of let him go now and experience life?
The fun that we also had during his rotation plasty is he fell and tripped over his saxophone and broke his arm. So we joke that we want to wrap him in bubble wrap.
I bet you do. I know it's kind of hard probably to find that balance of wanting him to go live his life, but also just protect him like a mom. So
Yes.
before we get to Dr. Rosenthal, we're going to talk to our experts here in our studio. We talked with Dr. Thomas Cochran, that's John's pediatric oncologist from Children's Mercy Hospital, about John's initial diagnosis and why surgery was John's best option.
He was first referred to us by his pediatrician after he had a pretty minor injury playing football, and it was continuing to get worse and had some concerning symptoms and signs that were associated with it. And he got some imaging that demonstrated a large tumor in his leg bone, and that's when I first met John, was for his initial oncology referral. And of course, you know, understandably, his family was pretty distraught and scared what was going to happen and how things were going to play out. So we got treatment started right away and took and reassured them as best we could with all the treatments that we were giving him, and plugged them into their appropriate support systems that are so important for these patients. At the time, there really was only one treatment plan for this sort of bone tumor in kids. Pediatric osteosarcoma is just recently getting new research protocols opened by the Children's Oncology Group. But for the longest time, including the time that John was diagnosed, it was just really one treatment regimen that we knew was the gold standard best treatment for that. And unfortunately, with osteosarcoma, the outcomes are really reliant on whether or not you can surgically remove the tumor. So for all of these cases, such as John's case, we absolutely try to remove the tumor, which can be challenging in some cases and not always possible, unfortunately, in all cases. But pretty much knew right away that we would be talking to our surgeons and talking to him about surgical options for his treatment.
This is where you come in. We're going to talk about rotation-plasty, but first, just explain what osteosarcoma is. It's a bone cancer, but is this pretty rare?
So osteosarcoma is a very rare cancer. Osteosarcoma is actually the most common primary bone cancer. Now, when I say that, when people think about bone cancer, most of the time they're thinking about cancers from other organs, for example, the lungs, the kidneys, that spread to the bone. That's not really bone cancer, that's metastatic cancer to bone. Osteosarcoma is a primary cancer of the bone itself. It's mostly a pediatric disease. There are about 500 cases a year in the country, so it is considered a very rare cancer. I've had the privilege, and as John pointed out earlier, he was blessed in a little bit of way. I feel the same way, in that during my tenure, my professional career, we went from a 17.4% survival rate from osteosarcoma to now where we're curing the vast majority of patients with osteosarcoma, not only curing them, but with good function and with preservation of the limb.
So you have to cure it. treat it, but now you're trying to get back to the function part of it, and that's where this rotationplasty comes in. And I had never even heard of the word, Dr. Rosenthal, as I'm sure many people had no idea what this is. So explain what rotationplasty is.
So as Dr. Cochran pointed out, part of the treatment, or part of the primary treatment, is surgical resection. We have to get rid of every last cell, every cancer cell in the extremity, in the lower extremity. So one way of describing that would be to do a formal amputation. In John's case, that would have been just below the level of the hip. But we also want to take in consideration, we want to give the patient back, especially because this is a pediatric disease, we want to give them back their life, their function, their formative years, their ability to play saxophone, to be able to walk out on the field at the Chiefs game at halftime, and to be able to enjoy things. So we have to look at functional restoration. But not only that, John was 13. He had a lot of growth left to go. So if we put in a metallic prosthesis, for example, an artificial bone, that doesn't grow. We have to take in consideration his potential growth, function, and cure of the disease. That's where rotation comes to play.
So Celeste, your mom, you hear your 13-year-old son has cancer. How did you and your family get through those early days?
It was a lot of shock. Of course, we got the diagnosis during the fun times of COVID. So we went down to the hospital to get an MRI or an X-ray, thinking it was just a bone bruise from soccer. And when the pediatrician comes in to talk to you before you see your son, it hit me at that point in time that this was something. They told me, and I went and called my husband to have him come down so we could talk to him as a family, the three of us, to let him know what was going on. A lot of shock. It was not anything that we had anywhere on our bingo card. It was shocking.
I would imagine. Nathan, as a physical therapist, what are the biggest challenges you face when helping adolescents with such a major adjustment?
Yeah, I think there's two parts to that. There's the personal side and the medical side to that. So the medical side is we've got somebody who's going through chemotherapy and they're dealing with the impact of that care. They've just had a major surgery and dealing with the restrictions that come after something like that. And then you have the personal side of it, that you have an adolescent. So my patient isn't always my customer. So I am helping John and as well as his parents through that journey and dealing with what they're now facing. And that can vary between each one of those individuals.
I was going to say, between a kid, a parent, you've got all sorts of emotions happening.
Yes, ma'am.
Celeste, when Rosenthal talked about this surgery, you said you thought he was off his rocker. You couldn't quite get your head around it. Tell me a little bit about that conversation when you first heard it.
It was nothing. I mean, you know about knee replacement, having a knee replacement. When he's 13, there was worry about, okay, how many times if something breaks, can something be repaired for a knee replacement? Usually you have that as an older person. But hearing that he was wanting to amputate and turn the leg around, the foot would be backwards, it took a while for that to actually settle that was probably the best option, because John, 13, he wanted to run around, he wanted to play soccer. Who doesn't at that age?
John, what was your reaction?
I think I was still kind of mostly in shock. It just didn't seem real to me. And then all of a sudden sitting there going over the surgical options and hearing like how extreme some of them were and hearing like the recovery and all that, it was kind of just sitting there and just like I didn't know what to think or what to do. And it kind of like I had a lot of time to decide what I wanted to do, and we were always kind of leaning rotationplasty, but it was kind of, I don't think we ever fully solidified a decision until probably the very last second we could have decided. And then even leading up to the surgery, still questioning if that was the right decision. So it was always kind of, it just never fully felt real to me until that day of surgery.
Well, Dr. Rosenthal, I mean, it does seem really drastic, but how does this surgery really help kids like John stay active? Why is it the best option?
So very good question. That's the whole concept of rotationplasty. And Celeste, I will tell you that I get that comment a lot when they first meet when parents first meet me, they do think I'm a little off my rocker and crazy. But I guarantee you, after years, there is a hug and a thank you very much, we love you. So I turn from weird to something else. In any case, what we have to take in consideration, and think about this conceptually, the ankle is essentially a reverse knee joint. So while the knee flexes in one direction, the ankle flexes in the other direction. In addition to that, if we can take the new ankle, and I'm going to call it the cankle because it's now the new knee, and put it at the level of where the other knee, the contralateral knee, will be at the end of skeletal maturity, now their new knees are equivalent. The foot becomes the new shin bone, and attached to that is a little stilt prosthesis in which a patient can really do anything, sports, etc. And we take all those in consideration. So there's a lot of calculation of age, potential growth, etc. So essentially we're talking about a amputation, but we're actually talking about a double level amputation.
But you have to have that conversation of, hey John, this is going to look really different, but you're going to thank me later.
I promise I do not discuss this at the first visit. I don't say, hi, my name is Dr. Rosenthal, I'm going to turn your leg backwards. There is a way of talking, and we have a program set up where we do connect patients with rotation plasties with other patients who have gone through the procedure and to see how they do.
All right, Nathan, after a surgery like this, just where does the recovery begin, especially for a teenager?
Yeah, well, for any patient, I mean, you have to stop and think that they've been undergoing continued medical care. They've been through chemo, they've been inactive for a while. So they're really, really deconditioned. I mean, yes, the surgery that they just had, we need to address the strength and the motion in that leg to get it prepared for a prosthesis, but we also have to worry about the individual itself. You know, how are they able to gradually build up? And so we work on the core and their overall endurance as well.
All right, Dr. Rosenthal, you have to brag on yourself just a little bit. How specialized do you have to be able to do a surgery like this?
Orthopedic oncology is a very, very subspecialized field. There are not a lot of us in the country, and not a lot of surgeons do rotation plasty. The blessing that I have, or the privilege that I have throughout my career, is we've technological marvels at what we can do. So another option could have been, for example, a growing prosthesis. But as John alluded to, that's not going to last a lifetime. So now he's going to be, and I'll say, condemned to multiple surgeries throughout his life, at which any time an infection sets in, which is a significant risk, that could lead to a even higher level amputation. With rotation plasty, it's usually one procedure, the bone heals, and that's a normal leg at that point.
So that was my next question. I mean, kids are still growing. So is it one and done?
So that's the beauty of it, is we can place that new cankle where the contralateral knee will be at the end of skeletal maturity. During that time from 13 to, let's say, 16 or 17, during that growth, we can adjust the level of the pylon of the prosthesis rather than of the bone of the patient. Okay. An alternative, for example, would be something called a non-invasive expandable prosthesis. A metal prosthesis that we can wave, I call it a magic wand, over the prosthesis, and the metal expands. There are a lot of risks to that type of procedure, and it is considered a temporary prosthesis. So again, you're condemned to multiple other procedures. And then with regard to the rest of the team, with Nathan, with Dr. Cochran, and there's a lot of others involved, communication is key. Okay, we've got to teach John that in order to flex his new ankle, he has to extend his old knee. And that's all done in the brain and markedly fast. It's amazing how people do that.
It is like a magic wand. I have to, I'm trying to get my head around it. It's fascinating. Nathan, how do you set these realistic goals when it comes to recovery?
Sure, and I think the key thing here is all goals are important and golden. You know, with families coping at this time, we want to continue to give them something to aim for. So really we talk about milestones more than what are realistic goals. So, you know, we have to get the strength and the motion in the foot before we can start putting it in a prosthesis and walking. We have to start walking and getting around before we start running. And so if we talk about we have to, in order to get their final goal, we have to accomplish this first, it really helps kind of frame that conversation.
John, what was the hardest part of recovery for you? Was it physical? Was it emotional? Tell us a little bit about that.
I think it was a little mix of mental and physical. Kind of the having to hold back and not being able to do everything that I wanted to do or was used to being able to do, and having to kind of take my time and go through things, and like just like with the prosthetic, learning to walk and not have to use crutches while wearing the prosthetic, that alone took like 2 months. So just being able to have like patience and not get as frustrated with it, and kind of celebrate the small goals along the way. Like I remember the first day I was able to walk on the prosthetic without like any assistance of another person or crutches, and like how big of a day that was for me. Just like the being able to have those small goals to get to make it easier to see the bigger picture to what I'm working towards. It's like now I'm 4.5 years out of surgery and I run around and play basketball and do all these other things, and kind of think about where I was 4.5 years ago first starting in that kind of journey and working towards those goals, and now getting to them now.
Celeste, what would you say to a parent who might be facing a similar diagnosis like this for their child?
Patience. John was talking about how we would have meltdowns every now and then when he wanted to do something that he at that time couldn't do, wanted to go back to being the way things were. So we would have lots of conversations in which emotions were running high. One of the things he wanted to do was ride a bike. So Dad and I both got on the computer and looked to see what we had to do for his bike so he could ride a bike, and just taking it day by day, step by step. When those meltdowns come that he wants to go back to being a normal child, finding out what exactly they're wanting to do. He wants to do marching band. Okay, we'll figure out how we can do marching band. And he's wanting to do marching band at K-State, so he's wanting to keep on doing the marching band. He wanted to play basketball with his friends. We did that. So it's just taking it step by step, day by day.
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. All of that information is right there on your screen. Dr. Rosenthal, as parents, we hear of growing pains, but when your child complains of bone pain, how do you know it's time to get our kids checked out, that it might be something more than just a growing pain?
All right, so that's a very good question and a very difficult question, because after people see this type of broadcast, for example, every child has growing pains, or every child hurts their knee in soccer and so forth. But osteosarcoma is an extraordinarily rare disease. So obviously, I don't want to ever impart the thought that it could be cancer. But the answer to your question would be, if the child or any patient has pain that is not of the type of pain that one would expect based on that injury, certainly if it lasts longer than what would expect for typical or reasonable pain to occur, if there's any type of mass effect, that needs to be brought to a doctor's attention, and fairly quickly. But it is difficult, and as John is the example, we don't see these when they're small. They're usually, they're before the presentation, they're fairly large, because in and of themselves, the osteosarcoma doesn't cause pain until it destroys enough bone that it causes an instability or a mechanical problem. By that time, that tumor is fairly large.
John, what did support from your friends and your teachers and all of the community around you mean during this time?
I think that's a big part of what got us through it. I mean, just alone, like my two best friends, Owen and Tegan, were, when I was with them, always there to help me with what I needed. Like I remember the day I got out of the hospital from surgery, I went to go hang out with them, and them like helping me get out of the car and like go sit down and like all that stuff. And just like those small things of the people like willing to come help without asking, or just like the outpour of support, like seeing the amount of people from my church who wanted to make my family a meal, or the amount of people at school coming up to me and like talking to me in the hallway, like asking how I'm doing, what's happening, how like my teachers worked with me with my homework and like came up with alternate assignments or easier assignments to help kind of keep me on track with the schoolwork without being in school as much, because that was the other big part, is I missed a lot of school at that time. So just seeing all the people who went out of their way to help me and help me get through everything on more than just the treatment standpoint, just with life in general.
Well, Celeste, you recently faced your own cancer diagnosis. You gave us permission to mention this morning. First, just how are things going on your cancer journey?
I was diagnosed in June of last year. I had a double mastectomy in September. They had clean margins and clean lymph nodes. So I'm just taking a hormone blocker, and then I will have reconstructive surgery in June. So everything we caught it early enough. It was in a routine mammogram. Everybody needs to get a mammogram. I had no knowing of it being there. So yet again, another surprise by cancer. But yeah, we're moving through it.
Well, we're glad to hear that. But how has this, changed your relationship? You and John going through something. It's certainly not anything a mom and son want to bond over. But
No.
how has it changed things for you two together?
Well, I never thought I would get a tattoo. I think we've kind of talked about maybe doing a yellow pink kind of tattoo somewhere on an ankle or somewhere, just kind of as a bonding thing. I definitely know what John went through. I didn't have the expense of having to have the chemo that he did. But we kind of understand each other when good days and bad days.
Yeah, John, how has it changed your relationship with your mom?
I feel like in the moment of her diagnosis, I feel like already knowing what it was like going through the whole diagnosis process, having a better understanding of how to handle it together, like the patience, the helping. Like I remember when she got home from her surgery, just kind of like being there to help her with what she needed, because I knew there was not a lot that she could do in that moment. And like I know the frustration of having to sit there and ask other people to help you with every little task you can imagine that you're used to doing on your own. So kind of just being there to provide that support when she needed it and give her that help.
And we also have Dad and we have older brother Brandon, who are also there. So group effort.
I know you are a tight-knit family and have gone through this all together. Well, we asked Dr. Cochran, as someone who works with children, what other red flags parents should look out for, just to know if their child has had a minor injury or if it's time to go see a doctor.
It's a hard thing to know when something's crossing the line into something more concerning. Other things that you could look for as a parent would be if you are treating an injury that seems pretty minor with typical things such as over-the-counter medications, rest and ice, and things are continuing to get worse a number of days into it, that can be concerning. If you're seeing a large lump developing over time, that's definitely concerning too. Or if they're having symptoms that are waking them up from sleep, that's certainly a red flag for us as well. But certainly whenever there's a symptom that doesn't resolve in the way that you would expect it to for a minor injury or whatnot, you should be probably seeking advice from your doctor at that point.
For viewers watching, Nathan, when we see John moving today in that video out on the field doing his thing, what are we seeing that shows that this surgery and the rehab have been successful?
Oh, I think every second of that film shows you that it's a success. Function is our highest priority. I mean, yeah, we always tease John about him being pretty and, excuse me, wanting to look pretty when he's doing something, but just seeing him walk with a nice, fluid, strong motion, I can't ask for anything more.
I mean, right there, you wouldn't even know. I mean, it's like even right across. It looks amazing.
Absolutely. If he had pants on, you wouldn't know it.
You wouldn't know it. And for kids facing long-term recoveries, what is some advice? Maybe when progress seems slower than what they would like to see or feel.
Sure. So coming back to talking about the milestones, we all plateau when we train for anything, and being mindful and cognizant of the deconditioning that comes with that long medical course before they even come to my door is something to always kind of remind them of. And that sometimes you have actual medical fatigue. He's been poked and prodded and admitted to the hospital how many times in so many months. You get to a point where you're like, hey, you're doing great. Don't get frustrated, but here's what you need to keep working on. And I want you to take this. And we had a couple breaks in our relationship through John's care where he did plateau. But he was doing good and he didn't need to miss any more school. And so he continued to work on the things that he was doing at home. And when he had a new challenge, he came back in. So when he wanted to start running, when he wanted to get back to band, so we kind of had an on again, off again relationship.
And he really didn't. There's not anything he didn't get back to. It's like he just went full speed ahead. John, what is something that you accomplished that maybe you didn't think you were going to be able to do?
For a while, I didn't think I'd be able to actually run. For a long time, my run was kind of just a gallop to move, but now I'm able to run. I mean, I play basketball with my friends. I mean, running around, just kind of doing whatever with my friends. I'm able to keep up with them. For a while, I wasn't able to keep up that well with my friends, but they kind of realized that and kind of waited back with me and kind of were patient. But now I'm like able to keep up with them, and like I surprise my friends every day with what I can do. So.
And Celeste, just as a parent, as a mother, it's just what gave you the confidence to really trust the medical team to move forward with this surgery?
Dr. Cochran was wonderful. We have a really good medical team in Kansas City. We're lucky. I have talked with families who are going through things like this who have to drive 5 hours up to Kansas City for the same procedure. John, I can't even imagine getting up early in the morning to get to the hospital to do the blood work before we had the procedure. That was enough for me. And I lived in Kansas City to have to drive 5 hours on top of that. But yeah, the men that are sitting right next to you, I would give kudos to, hugs to Dr. Rosenthal when he came out after surgery. It was more of a marriage counseling session with me and my husband as to what we were going to be going through. So there was a lot of care there coming from both directions.
I want to get to some questions and comments from our viewers this morning. And Ruth Ellen says, amazing story to start the season. Good luck to all you do, John. Amazing medical professionals, too. Marcia says, so after this surgery, all the adjustment for growth happens with the prosthesis, not surgery, correct?
That's correct.
She says, if so, that is amazing to be able to also accommodate for this future growth without a painful procedure, which is, again, why it's amazing that somebody can be the right candidate for something like this.
So as I mentioned, the team approach is so important. So the prosthetist who is involved, we have to have a prosthetist who understands rotation-plasty prostheses. But to adjust the pylon, which is essentially just a pipe connecting the socket that the leg goes into, that the foot goes into, and then the foot itself. And by the way, the foot can be anything you want. You can have a flex foot or a jumping type of foot to play basketball and so forth. But to adjust that height is a very simple thing. It's a lot easier to operate on a prosthesis or a pipe than it is operating on a person.
Right. Linda wants to know how important early detection is with osteosarcoma. I mean, I would imagine with any cancer, but particular with this one.
Right, so we do like to, I mean, it's always best to diagnose early. The reality is it is very rare to see an osteosarcoma less than 5 centimeters, for example, about 2.5 inches. That's very rare. Most are significantly larger than that. And as I said, because unfortunately there are no blood tests that give us a clue, there are no specific symptoms. It's usually a sports injury. It's usually a dull, achy type of a pain. It's very subtle types of symptoms. It's tough.
Well, Janine wants to know a little bit more about your dreams of heading off to K-State and playing in the marching band. John, did you ever think that this would be possible after this surgery?
I think for me it was less of did I think and more of it will be and when I need to get there. So kind of just working towards it. I mean, I remember the first day of marching band freshman year and realizing how tough it was to be able to walk like that, because at that point I wasn't even walking normally to the standard that I wanted to be at or Nate wanted me at. So trying to figure that out and kind of, I go back all the time and watch videos of the marching band shows from high school and look at my progression over the years, and that's kind of one thing I look at to kind of see how far I've come. So keeping that going into college and K-State and being with the Pride of Wildcat Land, which I've been looking forward to for a long time because I'm a very big K-State fan. So being able to be a part of that and be on the field and do that is just such a cool thing that I'm looking forward to doing and a big thing for me.
John did do, K-State has a program called the All-Star, in which he would go up and actually march with the K-State band during a football game during halftime. He also had the benefit of his older brother, who is also graduated now from K-State, being in the marching band and seeing firsthand what that will entail. It's almost a 40-hour job.
Well, it's I can tell the Wildcat spirit. It runs deep in the family, so we're really excited that this is all coming true for you. And Celeste, you know, as we get our takeaways today, what do you want the big takeaway from John's story, from your family's story, to be?
You just need to, versus looking at the whole thing and years down the road, months down the road, just taking it day by day, step by step. What do you want to accomplish? John wanted to ride his bike, so we figured out what we needed to do to put on his bike so he could ride his bike. He wanted to go play basketball with his friends, so we made see how we could do that. He wanted, soon after the surgery, before he had his prosthetic, he wanted to go visit his friends. Again, during the fun COVID, and what we needed to do to get him so we could see his friends, and his friends would come and help get the chair and the pillow and everything that went with John at that point in time, so he could sit and have fun with his friends. It's just taking it day by day, little by little, and reaching out and talking to friends and seeing where you can get some support.
John, what do you want the big takeaway from your story to be?
Everybody's going to have their difficulties in life, whether it's a big difficulty like going through cancer at 13, or it's going to be struggling with your classes at school. Whatever it is, there's always going to be roadblocks along the way in that journey, and learning to not just hit a roadblock and just sit and not do anything, to hit that roadblock and kind of look at it and decide what you need to do to get around it or get over it, and not just sit and dwell in the difficulty of it. You've got to keep moving always and keep pushing forward is the biggest thing.
Well, we just thank you both for sharing this incredible story, and you're both just fantastic. So thank you for that. Nathan, what do you want the big takeaway this morning to be?
That it's time to take off the bubble wrap, John. It's time to get after it, buddy. You know, we're all so proud of all the hard work, and I think the takeaway here is to everyone's point. It's like, surround yourself with a good team. Find the experts that you need, and keep asking those questions. For so much stuff in John's recovery, the answer is yes until it's no. When he wanted to run, when he wanted to get back on a trampoline, it's like, well, yeah, okay, buddy, but first we got to let that bone heal up. We've got to reach some certain milestones. And so just approach it with an open mind and lean on your support.
Don't take Celeste's bubble wrap away completely.
It's time.
Come on. She's a mother. Let her have a little on the side. All right, Dr. Rosenthal, what's the takeaway from this incredible story?
Well, in all honesty, I always say it's the inspiration that I get from my patients. Mm-hmm. So John, I do want to let you know, I think you know this already, that John and I share some common interests. I also played saxophone in band, and we both like fast cars. But we also both listen to our mothers, so what your mother says does go. But it's the inspiration that he gives to anybody that he meets, and that's going to be for the rest of his life. John is somebody special that has gone through something that very few people in the world have gone through. He has a story to tell.
Mm-hmm. Already. Yes. At such a young age. And I learned something new about you, fast cars and saxophones. I love it when you come on. Thank you so much, gentlemen. Thank you for your expertise this morning. Celeste, John, again, thank you for being with us. We, as always, thank our viewers for joining us, and we will see you back here tomorrow. On Tuesday, Jim Ondick is a childhood cancer survivor, and that cancer cost him his left eye. Decades later, he has cancer again, now in his brain and lungs. We share the treatment and science behind his survival.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.